So we'll just start off at this point because we're time conscious. Apologies for starting a little bit late. We're waiting for some of the attendees to come online as well. So I would like to welcome everyone to the first Gricd Cold Chain webinar series. It's the first in many that's to come. And like we mentioned, this series will be speaking basically to the effect of cold chain on healthcare. Basically, we brought on seasoned panelists alongside some of our partners to speak today, talking about some of the challenges that exist in the healthcare space as regards cold chain and the opportunities that exist for private sector players and how we could overcome some of these challenges. So I'll quickly run through the agenda that we have for today, and then we will take it up from there. So today's event is going to last for a maximum of about an hour, 30 minutes. Basically, we would start by this introduction, which I'm pretty much giving at this point in time. So we just have a 5-minute shift in time. And then we would have introduction from one of our partners, one of our gold partners, which is RMX. And then we would have opening remarks by our seasoned panelist, who is Gavin Pearson. And then we will go into the gist of the day, which is basically engaging some of our amazing speakers, including Vivian, Debo, and Taiye, to speak about some of the challenges that they experience in their businesses and some of the solutions that exist and how we can work around some of these challenges as well. Then the next will throw open a Q&A session where everyone has the opportunity to ask questions from the panelists, depending on what the questions, different questions to the panelists, sorry. And thereafter, we have somebody from the Gricd team speak about one of our solutions, and then we'll have a Q&A session after that, and then there's a vote of thanks, which would ultimately close, would bring the event to close at 5:35 p.m. today. So without, sorry, 1 second. Without further ado, I would like to welcome Gavin on board. Gavin is the current managing director of Chisco, Nigeria. He's done a lot of work with he has a lot of experience spanning over 25 years. Worked with organizations such as Imperial Logistics, DHL, and has worked across various countries in Africa, ranging from including Nigeria, Ghana, and some East African countries as well. So he would be the moderator for today's event, and he would be, oh, I'm sorry, I made a mistake, not Gavin immediately. We'll be introducing Haider Khalil. He's currently in RMX, and RMX over the past 3 years has made major investments in the cold chain space to enable or to improve the distribution of pharmaceutical products. So over the next 5 minutes, Haider will be speaking to what they've done in this space and some of the opportunities that exist. So Haider, over to you.
Thank you very much for that introduction.
Thank you.
Good afternoon, ladies and gentlemen. My name is Haider, and I'm a representative from RMX Nigeria. It's an honor to be part of this webinar and this partnership that we have with Gricd. Sorry, just please let me know. Can you hear me? I think there's been a...
Yes, yes.
Okay, great. So I will just share my screen for a little bit of a presentation, and kindly let me know when you are able to see.
Yes, your screen is up now.
Excellent, very good. So I will just yes. So my name is Haider, and I'm a representative from RMX Nigeria. We're very glad and proud to be part of this webinar and excited to introduce to you our company and the capabilities that we do have in the healthcare sector globally and most importantly in Nigeria. Now, Aramex Healthcare is a part of Aramex. Aramex Healthcare originated due to the business model that is designed around moving shipments urgently. Aramex in general, we are available in over 65 countries. We have over 600 locations and over 15,000 employees. We have a range of different services and solutions, but the healthcare sector of Aramex was designed around urgent moving shipments with a rapidly changing world. Aramex established this vertical to be ready for large changes in the industry. Some of the services and solutions that we do provide in general, just to give you a brief understanding, are the compliant packaging solutions, hospital supply chain management, temperature controlled delivery, customs clearance, GDP warehousing, GDP compliant warehousing. Some of the issues and problems we've realized in not only in Nigeria but around the world is just temperature controlled vehicles, temperature controlled products are very sensitive. Therefore, we've realized there was a gap in the market here in Nigeria and globally, but most importantly here in Nigeria. And we found some problems along the way. So we thought, how can we tackle down these problems and grow this sector and make this sector a better place? One of the things we've done is invest in our own temperature controlled vehicles. Being a compliant company, we want to make sure these vehicles are fully calibrated. This will ensure that the integrity of the product is not compromised. As we all know, transporting temperature sensitive products from point A to point B is a very, very critical and strong, what would I say, deviated operation. We need to make sure that the product is not compromised. Therefore, this is why our temperature calibrated vehicles are all fully calibrated to the maximum. Apart from the investment in temperature controlled vehicles, we also looked at temperature controlled rooms. These rooms are also calibrated, and we want to make sure that whatever products, whether it being vaccines, pharmaceutical products and medicines, are being stored in the rooms or in the vehicles, that they are under the correct temperature at all times and the product itself is not compromised. Being compliant for us is very important. Part of the compliance is also providing trainings to the employees that handle the delivery, the storage, and the communications. Just a brief understanding for you regarding our supply chain flow. We provide services from first mile, middle mile, last mile, and value-added services. We know in the pharmaceutical industry, in the cold chain industry, and the healthcare industry, there are different services, there are different areas, there are different miles that we can come in and help establish a good service. The first mile would be services that include customs clearance, freight services. The middle mile would be the warehouse and storage, where we've invested in a new warehouse, we've invested in new cold room storages. These will be able for us to provide you with services and a resource management. Last mile deliveries, which is the last mile part of the supply chain flow, would be the distribution to the hospitals and the clinics. Being in Nigeria over 6 years as an Aramex Nigeria, and I personally have been in Nigeria for most of my life. I grew up here. I understand the terrain of Lagos and the mainlands and Nigeria in general, and how sometimes the roads and the routes could be difficult. So in this case, we perfected our last mile distribution. It includes domestic distribution, multi-temperature movement, tracking and visibility, which means at all times one would be able to see where the what. I believe visibility is one of the most important things in the sector for healthcare in Nigeria. Along with that, we're distributing vaccines. We're providing solutions for vaccines distribution, and in the future, the COVID-19 vaccine distribution. We are developing a solution for that as well. Some of the added value services, which is the serialization, the project management, insurance, customer experience. We want to make sure that the services are not only just pick up, deliver, and making sure that the product is not compromised, but also giving the customer an experience, a visibility, a level of comfort to know that their products are in good hands. Some of the tracking solutions, not only as in the cold rooms and temperature vehicles we've invested in, but we've also partnered with Gricd and their phenomenal temperature monitoring devices. These devices, they have ranged from real-time data loggers to their Cold Box 15, Cold Box 50, the G330 and the G720. Now, I'm no professional at promoting the products of Gricd, but I can assure you, I can tell you that we absolutely love working with these smart tech, as you would say. Technology is growing around the world, and I believe in Nigeria, the more tech we use, the more visibility we get. And this is part of the solution for the healthcare industry in Nigeria, the smart tech, the one that allows you to monitor. Moving on, just to give you just an idea of our supply chain flow. Globally, we are the healthcare industry for Aramex globally is well known and well practiced. We provide temperature control trucks from the origin at different temperatures. They can pick up products. We move shipments via air freight in an environtainer. We provide clearance, delivery of validated temperature shipments. We have the shipments that arrive at accredited warehouses. Our Aramex implant team prepares the shipment delivery. They're fully trained staff. The delivery goes again in another Aramex temperature controlled van, which is fully calibrated to hospitals and clinics. We also have hub and spoke networks, which I will briefly touch on later. And finally, we deliver to the end user. Some of the innovative solutions we also provide are the WhatsApp chat box. We interact with customers through several touch points, such as WhatsApp. We have the Aramex app. The Aramex app allows Aramex customers around the world to manage their entire experience using mobile phone. The What3Words is another software we've partnered with for the address management system, where we can improve the delivery success rate in regions for poor quality addresses. Last but not least, we have the dashboards. Our dashboards are really cool tools and system capabilities that start with capturing the transportation milestone, customized alerting, and end with monitoring the shipments. These are just some of the innovative solutions we can provide. Now, for the implementation framework, what we do, we like to do is, at the beginning, we can provide an analysis and understand what the challenges are. Then we can design a solution, identify risks, and prepare a mitigation plan. We then deploy the first shipment, the first service, the first, how would you say, movement. And it doesn't end at the deployment level. We monitor. We then monitor this movement. We monitor this clearance. We monitor this shipment. We monitor this transportation to make sure that it is meeting the KPIs. And how can we improve it, whether it's being routes or timing? For us, this is an important part of the implementation framework in general. I'd like to thank you for the time. It's a brief time we have, but I'd like to thank you for being part of this webinar today. We will pass on our information to Gricd, and we would be more than happy to schedule a call or further meetings down the line to collaborate with you on how we could improve the services and the healthcare industry in Nigeria. Thank you very much for the time.
Thanks a lot, Haider. Thank you so much for your time. We'll move on to the next aspect of today's session, which is the panel session. I'll be introducing the moderator today. then subsequently he will take up from here. So our moderator today is Mr. Gavin Pearson, currently the Managing Director for Chisco Express. I'll read a little bio about him. Gavin is a Managing Director and co-founder of Chisco Express, a technology logistics company implementing logistics as a service model for African markets for development of goods from origin to last mile across multiple nodes. Gavin served as the Managing Director of Ghana arm of DHL and then moved to Lagos in 2006, where he became the Managing Director of DHL Supply Chain in Nigeria. After serving for over 4 years, he made his entry into healthcare, resuming as the Director of International Operations, Imperial Health Services. After 6 years in the role, Gavin then led as Managing Director, Imperial Regional Activities in West Africa. Gavin led the establishment of supply chain in Malawi that in 2011 resulted in circa 700 primary healthcare facilities in Malawi having access to essential medicines after the state's supply chain had collapsed. The work involved establishment from a greenfield state to having warehousing and distribution solutions developed and operating within 2 months. Gavin has also been part of the leadership team that has implemented the unified supply chain for ARVs in Nigeria since 2012. The work involved established a network of zonal warehouses and distribution subcontractors from greenfield states to an operating and unified supply chain. Gavin gained a master's in human geography from the University of Aberdeen in Scotland before securing his 2 further masters in logistics and supply chain via the University of Pretoria and Rotterdam, respectively. Gavin has consulted for various entities for operations in Africa and is a non-executive director of Chisco Transport Nigeria Limited. What's not stated here is that Gavin is partly Nigerian or is wholly Nigerian from his experience and the time he served here. So Gavin, over to you, please.
Thanks so much, Tegan. I must confess, listening and seeing Heida's slide there, it's always comforting to realize when there's entities and groups of people like the group that we've got on the webinar this afternoon who are actually committed to improving and raising the level and the bar of compliance and services that's available, because there's no reason that any patient in any country should get anything or expect anything other than just absolute service. So it's a real privilege to be here. Good afternoon again, ladies and gentlemen. Main object of this webinar, as Taiye outlined, is looking at cold chain monitoring, a tool to curb losses in temperature sensitive medication, especially healthcare. So I think as Heida's slide deck and as Taiye has mentioned, obviously temperature sensitive medication is extremely vital in many aspects of healthcare. It's extremely critical in terms of vaccinations, in terms of curbing infant mortality. It's essential in a number of areas, including helping to curb maternal mortality. And Nigeria currently ranks pretty poorly in both of those sort of areas. So I think for Taiye and team to organize a webinar for us to explore how we can look at how we can curb losses through proper cold chain monitoring is I know Taiye and team and all of us are extremely excited that you've been able to take out the time to join us. We thank you for that. We'll try and stick to some of the rules that we've set about time. Just a couple of other house rules. Taiye's got the admin power to mute all of us, so that's really aimed at trying to limit background noise as much as possible. We have got a couple of sections, as you saw in the agenda, to ask questions. So please keep the opportunity by putting your hand up using the Zoom meeting app to be able to ask those questions. So I just want to quickly introduce our panelists, and I want to just run through in no particular order. We have the privilege of having Dr. Debo Odulana join us. He's a founder of Doctoora. He's achieved significant improvement in patient experience. He's by re-engineering operating procedures, reducing patient waiting times by 30% over a 6-month period, just to name one of the achievements. He is an alumnus of University of Sharjah, UAE. He earned his MBBS degree there. He also holds a postgraduate degree in health management from Imperial College School. He's the co-founder of the Logic Foundation, which is a charity offering functional 3D printed prosthetics to Nigerian amputees. So some big kudos going out there to Debo, and as you can guess from that, he's very passionate about African development, very passionate about making positive contributions to improving healthcare delivery, reducing poverty, and making sure that we can leverage on education and innovation. He's the co-founder and advisory board member of the African Business Club at the Imperial College Business School. So Debo, it's an absolute privilege and honor to have you with us. Thank you so much for making time out.
Thank you very much.
To introduce Vivian Nwakah. She's the founder of, thanks Debo. She's the founder of Medsaf, and it's a tech-enabled medication supply chain. It's a management solution specifically aimed for hospitals and pharmacies. She's over 10 years experience in management, sales, marketing, strategic planning, business development, and fundraising. And Vivian brings experience that spans across a number of regions: South America, Africa, Europe, North America. So I think we can expect to get some real insight that we're going to run through from Vivian today. Vivian started Medsaf to reduce preventable death and streamline the pharmaceutical and scarce medications directly from leading manufacturers. And if anyone's ever had instances where they've had counterfeit or fake drugs, you will appreciate exactly how important the work that Vivian has been pioneering actually is. So Vivian, absolute pleasure to have you with us. Thanks so much for making time. I'd also like to introduce Taiye Adewale. Taiye is an expert in supply chain management. He has 7 years experience working in several industries. So looking at e-commerce, public health, oil and gas, FMCG, a lot of focus within Nigeria. He's a supply chain enthusiast. He currently using his knowledge, which is clearly quite extensive, and his expertise in supply chain management to advise the Nigerian government and the private sector on key strategies and policies that will strengthen health systems in Nigeria and across Africa. So Taiye, absolute pleasure to have you with us. Thank you so much for joining. Right, so I'd like to pose a couple of questions, and perhaps we can kick off. If we look at infant and maternal mortality, how big a role does cold chain play in infant and maternal mortality? We got an issue with Vivian on mute.
Hello. Hi, how are you? So I guess that question may be direct.
Hi, Vivian.
I don't know. So I can take that question.
No problem. Were you able? Thank you.
Sorry, it seems as though there's a bit of a delay. I don't know if that's on my end, but I'm going to continue speaking again. So at Medsaf, we're a platform to facilitate and finance the movement of medications, and we use technology and data to increase and improve the efficiency of that movement as it pertains to hospitals, pharmacies, but also suppliers and pharma companies as well. So, we're looking at the supply chain and how to just improve it through technology. I think one of the biggest things to really kind of point out about the issue in Africa and specifically in Nigeria is the fact that, you know, when you're dealing with tier 1 medications, like maybe your Sanofi and Pfizer, you know, there are very many ways that those medications can be distributed across the country in a safe, you know, cold chain all the way and get to these hospitals and pharmacies and then subsequently the patients in a nice and controlled manner, right? But then we want to look at, you know, maybe your tier 2 and your tier 3 generic medications. And these are medications that may be coming, you know, from local manufacturers, but many of them are coming across the borders. They're being imported, as 70% of all medications are imported into the country. They're also much lower price point. And herein starts to lie some of the nuances of the issue that would impact you know, the end patient, specifically if we're talking about maternal health, right? So we are combating the issue from the perspective of the, you know, open drug markets that exist across Africa, and we're targeting these lower level, or not lower level, but you know, cheaper medications that may not have the proper handling. And so I think some of the things to think about are, as it pertains to cold chain, is how do we find more innovative ways to provide cold chain to the average player in the market, the average supplier who's going to be supplying hospitals in the average location in Nigeria? How do you give them solutions that are cost effective enough for them to sustain the usage of these of the technology that should be in place? You know, how do you support local logistics, whether it's motorcycles, which many times are the avenue to actually deliver this to these hospitals and pharmacies? How do you support them to be able to kind of integrate cold chain solutions? And so, you know, where's the state of the technology now, and how can we innovate it to reduce the cost? Because the reality is that we're fighting against, you know, generic medications that are with the price point or the profit margin on these medications is quite small, right? And so, you know, typically, you know, it might not we not be able to find an incentive for a small local supplier to actually invest in the types of technologies that they would need to have proper storage and handling. And that's just one of the larger issues. So that's why you find substandard medication as, I think, one of the largest public health issues across Africa that's just untracked at this moment in time. You know, so absolutely, there's a way to crack this, but it's got to be very cheap. It's got to be extremely cost effective, and you know, we need to probably integrate technology in a better way to facilitate you know, these cold chain technologies at scale to actually start impacting some of the problems that exist in the market.
Okay, so would you say that obviously one of those challenges then, if you're looking at that tier 2, tier 3 manufacturers, is certainly around the cost to serve within a market like Nigeria, where we have infrastructure challenges, power challenges, maybe even the number of mature service providers, as you were saying, that can provide that service, and how you overcome that.
Yeah, absolutely. You know,
Okay.
definitely good there. And then that might mean supporting, maybe it means subsidizing, right? Like maybe it means you know, that might be part of the conversation. But the reality is that until things like insurance actually become more wide scale, where patients can actually afford to purchase medications or have, you know, more options to purchase or pay for their health care without it being out of pocket, there's always going to be this drive downwards on the price of medications. And if you think about hospitals and pharmacies, you know, their cost cent, you know, these hospitals and pharmacies, they're making their money off of the medications. You know, if they're getting insurance, if they have patients that have insurance, you know, they typically will complain about the fact that, other services, are, I'll just say lowballed, right, from insurance companies. So, doctors being paid for their service or consultation, that typically gets lowballed. And so they focus on medications as the way that they're going to make their money back, right? So I think there's this issue is there's so many complex pieces of this issue, and so we're going to focus on cold chain, which makes it everything more expensive. We've got to then figure out, talk about subsidies. We got to talk about, how did technology reduce the cost? You talk about how do you get it more wide scale usage of it through all the other various kind of, members of the supply chain to actually create an impact. But the reality is that there's going to be many different approaches to actually get to a place where, this is the standard practice in a Nigerian context.
100%. Thanks for that, Vivian. Taiye, I'd like to turn to yourself, please. Is there anything that you'd like to add there in terms of how big a role does cold chain play in infant and maternal mortality from your own perspective?
Oh yes, surely, Gavin. And before I start, I just want to confirm if you can hear me perfectly.
Yep, loud and clear this side.
All right, thank you so much. And it's great to have the opportunity to provide my view in this very, very important and critical area. I'll be speaking from the public health perspective towards how cold chain affects or influences child mortality. As we all know, cold chain is really critical to the elimination of preventable diseases that cause. A recent study from WHO actually analyzed that vaccines about 2 to 3 million lives every year, and you can tell that it's really immunization, right, is really strategic towards the control and eradication of these common child diseases. In our context, Nigeria, and this program actually led to drop child mortality has been able to decline by 57%, right? And that was from births to 69 deaths will not be achievable without the coaching, and also passive devices which it has caused a ripple effect. Shifted from just being the operation of coolant devices. It has shifted to a much more dynamic system whereby it's a chain of functions that are integrated to ensure temperature sensitive commodities are kept at the right conditions across the entire public healthcare value chain. So we see cold chain devices in production, you see warehousing, we see it in distribution, and finally to the last now, where consumption takes place. This journey has actually created huge economic benefits as children and pregnant females who are most vulnerable to disease, to these diseases. services, have access to high quality, all revolves around. And I believe there's still some with further development in this area, and also with the private sector being involved in public healthcare, in the public healthcare system, we should see some remarkable improvement across our public healthcare indices. Thank you.
Thanks so much. Thanks so much for that. So it's certainly clear that there's, if we can find a sort of sweet spot of innovative ideas to support the role that cold chain has already played. I'd like to ask Taiye a question and ask you, have you experienced a sort of cold chain challenge? You know, when was this? You know, can you talk to us around the circumstances of the cold chain challenge? Were you able to overcome it, etc.? I think that will probably help to put it into
okay. So
Okay, go ahead. So with us at Doctoora, and just building up on the last question and giving the perspective as to how in recent times the cold chain has become very key to our operations. We are very focused on reducing waste. We see that the major problem in healthcare is actually distribution of the created healthcare services. And in healthcare, tangibility of services and products actually serves as a very, very key determinant of whether the service would get to the consumer or not. And when we look at temperature sensitive items, in recent times, the case of taking COVID samples. We run a nationwide sort of COVID sample collection and blood sample collection activities. And with running that, we realized that samples in this scenario, apart from the fact that we want to track where they are at each time, we also want to keep them within a certain temperature, as they are quite temperature sensitive. And we're not talking about vaccines now, we're talking about the fact that we want to make sure that if we collect samples from a patient in Enugu and we need to run those samples in the lab in Abuja or Lagos, we want it to stay in the right temperature such that the virus is not sort of inactivated and useless, and the sample is not useless by the time it gets to the lab. And doing this on a day-to-day basis, the issues keep springing up because without adequate tracking, you're not able to guarantee the quality of those samples and the yield of the test. And that becomes a quality assurance issue when we look at it from the economic point of view. The economics of ensuring that we do not achieve negative externalities from releasing false negative tests, or in the case of a damaged sample where the virus was probably denatured in transit due to lack of cold chain. And those negative externalities, if we see in the cases of COVID, would mean that a false negative test will mean somebody is out of isolation and spreading the virus. And we can see the impact of that at a broader scale economically. And it's important that in most cases, we are trying to prevent a waste of resources, as well as trying to prevent the situations where we are given false hope or wrong results in terms of diagnostics. As Vivian rightly stated, medications that because of the faulty transportation, we have incurred a lot of distribution losses, and those medications don't even have the right quantity of active ingredients anymore. And then vaccines, which I think hits home mostly because we do a lot of routine home care and home care vaccination, which obviously involves us taking our Gricd fridge, putting those vaccines, we have to collect them from the local government, putting them in there and making sure that for as long as those vaccines are with us, we're able to transport it. Now, if we look at the real scenario in that case, most hospitals do not, utilize the full capacity of the vaccines because, once they open it, if they don't have enough patients waiting to take take vaccine, then the rest of the vaccine vial has probably gone to waste. However, if we have a very good cold storage and optimized operations, like Vivian alluded to, then I could plan for a full day of vaccination in Ikoyi, where I go around from house to house and make sure that none of my vaccines actually go to waste. And by not going to waste, I'm saying they are at the right temperature, that they're not getting denatured, but I'm also maximizing the use of the vaccines and no quantity is actually going to waste.
And Debo, what sort of technology are you using at the moment from a cold chain monitoring perspective that's helping you sort of mitigate some of these challenges that you've been talking about?
So first, way earlier with just using regular coolers, and we realized that with those coolers, obviously there's no tracking. And I think finding out about Gricd, actually, we had been in an incubation program together, and we understood that, okay, with this sort of innovation in the market, and at the time they had the fridges, those mobile refrigerators that we could put the vaccines in, we could put the blood samples in, such that once the distributor, which is the logistics partner, picks that device up, they can transfer it to where the doctors are or where the laboratory is, respectively. Recently, we had shifted from the fridges because I think there was an issue around cost efficiency and being able to get fridges that are large enough and affordable enough. So we started exploring the modes, which I'm sure they'll probably talk about a bit more. And that has even given us a very strong sort of feedback loop to be able to track where drivers are, also know at every point in time what the temperature of those things we're transporting are. And in this case now, we are buying regular coolers, getting ice packs, and then putting the modes with our samples such that they are able to be transported in a sort of protected.
Okay, thanks, Debo. And Vivian, in terms of technology that you're currently employing on your side, what sort of technology are you currently using?
Yes, so in the cases where we warehouse, so I'll kind of just explain a little bit more about how we work in the market. So our goal is not to be a distributor, right? We're just facilitating. So we'll work with, other as it pertains to vaccines specifically, we'll work with, reputable vaccine players that we vet, and we continue the chain using usually their equipment that then we do our own tests on where that the validity of that shipment over time. So for example, during lockdown, we started getting requests from all over the country, and we started shipping across the country too, to places that we had never been. And we were definitely getting, requests for vaccines, and we were, able to ensure and to be very sure that once we delivered to a new hospital, that we were able to get all of the information on temperature, throughout its journey, right? And so that, it's not so high tech at this point, right? We don't have, I know that there's technology that allows you to have, a tracker where it can kind of ping you and alarm you when there's an issue and those types of things. But when you're dealing with, a network of logistics players like we're dealing with, you also have to start thinking about, how do you get your equipment back? So if I pay for this expensive, tracking system that I can use and will give me the kind of data that I need to ensure, how do I get it back? And how do I get it back from, especially if it's cross country? So these are some of the things that I think are just super important to kind of figure out how to crack. We haven't cracked it yet, but we're open to working with players to kind of, figure this out. So that's just an example. And in our own internal, warehouse, we definitely have, very, very good refrigeration and et cetera. But we use data to match the demand as close as possible. So we've been working for the last 3 years on, we know that hospitals or pharmacies need to get their supply within 24 to 48 hours to prevent them from going to open drug market or less, reputable sources. So how do we use data to, improve the efficiency of internal operations, internal quality control, as well as have such a broad network of suppliers that we vetted that we can find medications up to 95% of the typical a vaccine order might come in the morning and it's already out the door, right? So, we try to kind of really just reduce the amount of time it takes to go through our system. So that's how we've worked with it. But yeah, we want to innovate around that and definitely are open to ways that we can take it even further. But cost is important.
Sure. So quick follow-up there, Vivian. The challenge of getting technology returned, was that just during the sort of lockdown period, or is that an ongoing challenge for you?
It's an ongoing challenge, right? Because so one way, I guess we could get a cold chain box or something that they purchase. Maybe we can have it come back and forth. But if you think about it, if I'm shipping to Abuja with one logistics partner, then I've got to pay for them to ship that box back. How do I get the box? How does how do we get it back? I don't know. So I think it's been a challenge for us. I'm open to suggestions on how to make this better and how to use better technology. But right now we're trying to use anything disposable specifically for this reason. Okay,
I get you. Okay, thanks, Vivian. And Taiye, a question to yourself, please. Vivian raised a very interesting point about insurance and the role that insurance can play in this aspect. Do you want to pick that question up for us, please, and just give us some views, Taiye, around what role you think insurance can play?
Looks like he's on mute.
Taiye,
okay.
I thought you'd gone shy on me.
No way. So thank you, Gavin, and interesting points from Vivian. I think one of the critical challenges for insurance companies in this particular sector is more of the high risks associated towards the handling of these temperature-sensitive commodities, because across the supply chain system, you have so many factors that can influence the integrity and efficacy of cold chain commodities. Speaking the rates, that an insurance company would give to a provider that is actually working on vaccine distribution, and also because of the cost of these devices. A solar direct drive costs a whole lot of money, and also the working cold rooms. There's so much money involved in that area, so definitely the rates will be higher. So I think for insurance companies, there has to be a balance whereby the leverage, whereby they balance the risks to what they can offer to the companies. And one thing that is that will be of benefit is technology, right? If these companies can actually create or create solutions that will be able to ensure data is available, to ensure that data is available, and also to ensure real-time visibility across their operations, then you should see some of these insurance companies feeling much more comfortable. Why? Because there's actually a the points whereby commodities are stored at temperatures that are not appropriate for cold chain items. Also, be comfortable because this reduces the risks associated towards vaccine or towards handling of the temperature sensitive commodities. So I think it's going to be it's going to have to be a collaboration, right? And because if the premiums that are way too high, then the policies that the government can shape this premium. Also, once the insurance companies are comfortable and are comfortable with the innovations, with the solutions put in place to ensure that the losses are reduced, then you should see them actually going into actually providing some form of premiums for the companies. Again, there's so many factors. Because in cold chain, it's not only about these solutions, right? The cost of $50 to $100, the cost of a working cold room.
Okay. Thanks, Jay. I'm not sure if you've finished or if it's a bit of a network challenge.
In this, yes. So basically, I feel much more innovation has to come, and this innovation some form of these innovations have to drive associated towards the storage of these commodities. Then you should see these insurance companies being comfortable to actually provide premium.
Great, thanks, Tay. Taiye, quick question to yourself. I see that there's a couple of hands up. Can you play your admin role, please, and let's just reach out to the attendees and let's look to take a couple of questions, please.
Okay.
I see there's a couple of people that have got hands up.
Okay, on that now.
Thanks. So we have a Yashpal, we have a Odulana. Who's going first, Tigger?
I think Yashpal would go first, and then Okpa would go second. So okay. Yashpal, you've been permitted to speak.
Still shows as mute on my side.
Yeah. Okay. So I'll just move over to Okpa, and then we'll see how that goes.
Hello.
Okay, hi, Okwe. Yeah, please, your question.
Oh, thanks so much for this opportunity. Yeah, quick one. I know visibility is critical in cold chain, and we've had a lot of challenges in that area. But my question is, what are the major challenges that are facing cold chain logistics, especially in this part of the world? And what are the affordable solutions? You know, I know of tracking and checking the temperature and the humidity is critical, because I know there are data loggers. And if there are data loggers, that means after the whole thing has happened, there's damage, that's when you begin to see, you can now go to the logger and be able to record. Do we have real time? That if there's any problem, then solution can be found immediately. Thank you.
I can take that.
Right, thanks for
Okay, so it's kind of what I was trying to talk about a little bit earlier, and I think that one of the major problems is not necessarily that there aren't solutions, right? It's going to be around already the cost of logistics is extremely expensive, right? So if you think about shipping something from, you know, Lagos to Abuja or Kaduna, unless you have warehouses and hubs cross country, right? So unless you've got warehouses and hubs cross country, and you can kind of coordinate the movement of your medications at your will, you're gonna have to work with a network of logistics providers, and those logistics is only just now even talking about tech-enabled anything, right? You know, let's think about the options that we have, you know, so that's a huge problem, right? The cost of logistics, you know, if I want to FedEx medications, I'm not going to FedEx medications to someone who, you know, to a remote rural village, right? I'm probably going to be FedExing medications to one of the largest or most one of the largest or most expensive, you know, hospitals, because those are the people that can afford it. So we've got, you know, this issue of affordability. We've got low margins on medications as an issue across the board. That's also something to think about. And then we have the issue I was kind of trying to bring up earlier, which is how do you get your equipment back, right? So if there were throwaway devices, you know, if there were some type of throwaway devices that, you know, are, you know, pretty cheap, that can be put in your boxes, and once they're opened, maybe then the hospital can throw it away, but it has done its job, that would be great. I don't know if a technology like that exists yet, you know, but it's about how do you get your products back, and how do you send your products, and how do you get your products back? I think that's one of the biggest issues for cold chain as well.
Okay, thanks, Vivian. Debo, would you like to add something there in terms of maybe some views around some affordable solutions or some ideas around solutions? I guess whenever there's innovation, sometimes affordability is a bit of a challenge, and it's only when innovation gets refined or scaled that affordability can come in. But yeah, perhaps give us some views, please, Debo.
Yes, I was just going to say that I feel like the major obstacle now is that if we were to critically look at the innovation curve for this cold chain solutions, we're very, very much in the early adopter phase. And until we gathered a vast majority, we might not be able to achieve those sort of price performance advantages that would be unlocked by reducing the cost and making sure that for every cost that is deployed, you can maximize those resources. And it's kind of alluding to what Vivian has just spoken about, you know, creating devices that could be thrown away. If you actually have to create a device that could be thrown away, it means that as far as you have deployed that device, the cost, benefits, and the value derived from that device outweighs the need to retain it. And we need to really realize how much innovation and how much adoption of these technologies has to occur before we get to that level. We're talking about the fact that we're at the price performance level that we can equate to the bottled water of back in the days. And for us to make this thing cheap, we must figure out how to create the pure water version of it. And with the pure water version of it, then we can now start thinking about bottom of pyramid, making sure that the logistics and the last mile can really get there. But before we even get there, we must look at the center phase or the early majority phase and figure out what are the critical social nuances. And what I need to say about this really is I have visited about 5 hard to reach communities over the last 2 weeks as a part of surveys to see what's really happening at those underserved communities. And what we are seeing is that vaccination penetration is actually an issue. And I'm going around and I'm seeing that the vaccination teams that leave the local government have to travel an average of 2 to 4 hours to reach these communities. And then most times they have to travel by boat. These are very remote regions of places like Lagos, for example, that are very rural. And when this community health worker or vaccination nurse arrives at the community, there are also nuances because there isn't actually a health center. So, you know, we're seeing scenarios where people have to gather at another person's house to get their vaccines. People are not coming out to vaccination because they don't want to go to someone else's house. Or the alternative is the nurse has to go door to door doing this vaccination. Now, if we take these learnings, we will realize that those cooler devices that are not, you know, regulating the temperature of the device, the vaccine, are really doing more harm than good. And we need to be able to curb those vaccine losses, as well as curb, you know, the incidence of, you know, false and ineffective vaccine administration, because that is even worse than not giving the vaccine at all. And those are the real peculiarities that we see in an African scenario, even in a city like Lagos, that has a very, should I say, modern approach to logistics metropolis. So if we were to realize that the real work is actually in distribution, you know, how do we get the healthcare to the most remote places without compounding the cost of healthcare delivery, knowing fully well that in healthcare, the most critical resource is time. And once time is burnt and time is lost, then healthcare actually has gone to waste. So if I was meant to get to a vaccination spot by 3 o'clock and I got there by 4, I actually have wasted 1 hour of vaccination time, potentially wasted some medication, some vaccines as well, and then potentially incurred some future losses because those people who did not get the vaccinations would now be susceptible to infection or disease in the future. So if we look at that depth and the economics, and you know, when we're looking at the economics of future costs that will be incurred, it's really important to get it right at the beginning. And that is why the coach is really important. And I think I'll just leave it for the other speakers at this point.
Thanks, Debo. But I mean, how, you know, the sort of scenario that you painted, I think is 100%. But it's also sort of a challenge to secure that adoption and scale and for any innovation or tech or even a logistics and distribution entity to generate that scale. If you're going on a canoe to an island, if you're going on a bike, at the end of the day, if it's in a remote part, it's had to go through a significant journey. It's been handled a number of times. And of course, every time you're handling a cold chain item, there's increased levels of risk, etc., to you breaking the chain of custody and integrity of the product. So are we trying to chase something that we're not going to perfect entirely in terms of affordability in some of these more remote locations?
I was gonna
so
I wanted to answer
the remote location.
Yeah, so I think that's a really good question. I think there's a delay. I think it's a really good question to ask. And I think it takes all stakeholders kind of thinking about their responsibility here. So for example, the pharmaceutical companies, we haven't talked about them. We've talked about vaccines in liquid form that have to be kept at a certain temperature, right? But where is the push also for innovation so that those vaccines can be in powder form, ready to use and mixed immediately without thinking about it, so that they can easily just be administered in one shot, right? That I know that is, some of our vaccines are in that form, but it needs to be more widespread. It needs to be more tailored to dispensing, or just kind of, it just needs to be easy to use, right? We've got to start packaging healthcare for Africa and emerging markets in a way that it's dummy proof, right? Like if there's not a doctor around to administer this, well, I've got this, I click this button and boom, I can stick it in and I know it's done, and I don't have to be trained to do that. Let's start talking about revolutionizing healthcare, to go around our issues, over our issues, instead of just saying, let's be like the West, because the reality is it's hot in Africa. It's just hot, right? Like it's hot in Asia. And if you don't have the money to come into the market at scale, if so, just kind of think about it. My company, we started in 2017 with my savings. There's no way I could have started anywhere else other than Lagos. If I had gone to a rural, community to start the company, how I would have already blown all my money on just logistics, to even just for me personally to get there, right? So you've got to realize that these companies that are going to keep popping up, they've got to start at the top of the pyramid. They're not going to be able to start at the bottom, but they can start at the top of the pyramid, start gathering the data that's necessary, and then start creating scalable solutions that can impact the bottom of the pyramid as well. And there can be a meeting point between doing this through the commercial way, which will ensure sustainability, but also doing it with NGOs and the government, and insurance companies, and everyone just kind of inching a little bit closer to putting in their part to making this whole thing work, right? So, I think we can spin this whole conversation around even a little bit away from not just cold chain, but just what are the ways we're going to fix this? Because as we've been talking, we realize that price is a huge issue here. Financing is a huge issue here. Logistics is, and these are so many players that are involved here that either make the problem worse or are trying to fix the problem as well. So.
100%. And of course, if everyone, or every product, or every manufacturer, or every stakeholder is trying to do it themselves in terms of a unique supply chain, then obviously there's a whole bucket load of duplication of costs there, as opposed to trying to consolidate it along with your cool drink or your FMCG supplies that go there, etc., etc. There's a whole world of opportunities, 100%. So thanks, guys. Take a quick question to yourself. Are there any more questions that have popped up, or are we looking for Simi to go through the motor presentation?
Okay, so I think at this point in time we'll open up the floor for any attendee to throw a question to either Gavin, Taiye, Debo, or Vivian. Okay. So if you have any questions, you can just raise your hand, and then
if there's any hands that come up.
One thing that I do think is a model that is working, I think could really work. You know, I saw it just today. I think it was Conga that is opening up their warehouses for renting out to other, you know, stakeholders, right? So there's a potential for some of these, you know, organizations that have large warehouse spaces to be able to adopt cold chain, maybe even through, you know, some type of subsidy or some type of, you know, grants or whatever to just kind of support and allow, you know, some of the suppliers that handle cold chain, you know, to be able to use these spaces, right, as they're, you know, packaging or receiving, you know, shipping, etc. That's one way to think about just how to share the resources, you know, just potentially across the country that could make an impact today, right? So, you know, that's something to throw out there.
Yeah, I
It's
agree.
a consolidation of supply chains type of thing. It's it's sharing infrastructure, sharing that last mile as opposed to duplicating it.
Yeah, yeah. I think we have a lot of supply chain inefficiencies that have arisen from duplication, and I think it's just from the lack of partnerships, the lack that everyone wants to own the whole value chain, and we don't realize that trying to forward integrate or backward integrate is actually just, you know, going to incur losses, and if we avoid those losses by, you know, finding strong partnerships, we can actually go a lot further. And the core thing I have seen is the lack of general investment, and the general investment issues have kind of sprung up because we're not utilizing our current resources effectively. And like Vivian likely said, a very good example of resources that are not being utilized rightly are the very empty warehouses that are all over the places. And even if the warehouse wasn't empty, the fact that it doesn't have the right cold chain infrastructure, that actually means it's not optimized. Right, so there's little things that go ahead that we really need in terms of infrastructure needs to be put in place, and then beyond putting it in place, it needs to also be optimized, used to the maximum efficiency possible. And if we can achieve that, I'm sure we will definitely be able to save more money and democratize access and reduce distribution losses as well.
100%. Thanks.
Okay, so we have a question from.
Also,
okay, Taiye,
okay,
sorry.
okay.
You can go ahead.
Right. So I just wanted to chip in that I guess I've heard a lot about private sector collaborations among themselves, but in terms of collaborations with the government, you know, I've not really heard about that, and it's really, really critical because at this point, there's an estimation that the government would actually require about 11,000 CCs over the next 10 years from 2000 and from 2020 and from 2015 to 2023, if I'm correct. So there's so much opportunity for the private sector to be involved in the public health cold chain system, right? And it also shows a clear business case for the private sector to work with the government. I think this is an opportunity that has not actually been taken to consideration by the government. Also, the involvement of the academia. So many of the problems that the other panelists have mentioned are things that the academia can actually do research on. You know, the data sets available currently, and there are also contextual factors, right, at the grassroots that they can be able to use to deep dive and find out what are the root causes and what are the clear solutions that will be able to best solve these problems. I think it has to do with a collaboration between the government, the academia, the private sector. also in terms of the people and systems aspect, when it comes to maintenance, that's preventive maintenance. And I think that is one of the best systems for you to actually reduce downtimes, for the storage of this coaching equipment, and also to increase the life cycle of these devices. This is one thing that, this is one lapse that the government has, and it's an area that the private sector can come into play. The government has actually tested various MOUs. They've actually tested various pilots whereby they ran MOUs with local vendors, and these local vendors were outsourced to provide preventive maintenance and corrective maintenance for coaching equipment. And it just shows the opportunities that is there, because the pilot was only done in 10 states, or 10 states, and across just one LGA per state. And we could see so much impact financially, looking at also the life cycle of the devices. We could see that they actually they actually were able to thrive, and also for in terms of cost, the cost of this, the cost of handling or the cost of maintaining these devices, was at a low when the private sector provided support to the government. So there has to be cross collaborations between the actors in this space. And I think if that can happen, we should see some value to the three actors. That's the government, the academia, and also the private sector. Thank you.
Maybe you can help democratize the access to the public sector in ways that are transparent as well as fair. That will help, the local entrepreneurs and companies to feel very comfortable to work with the government, also ensuring that there's financing and that there's ability to pay. I'm just gonna say that, sorry.
Yes, I agree. I completely agree.
So we have a couple of questions. So I would permit Yashpal to speak at this point. Then after Yashpal, we'll have Aina Aziz.
Yashpal, I think you're on mute at the moment.
Yeah. Well, I'll just take, I'll just maybe give Aina the opportunity to speak as well.
100%. Then there was a question that came in on chat, which is a good question that I think we could look at as well.
Hello.
Yeah.
Can you hear me?
Hi, Aina. Yes, we can hear you.
Thank you very much for the presenters. It was a very, very educative and enlightening presentations. Thank you very much. Actually, my statement would be in form of opinion, contribution, also questions. I'm actually a pharmacist, an intern pharmacist to be precise, and I'm currently running an internship program. But then I'm also running a supply chain course with from MIT, MITx. My question is, there is a particular, I know that the logistic is actually very complicated when it comes to the issue of the coaching network. And secondly, when you those problems that all the presenters highlighted, I believe the knowledge of artificial intelligence and machine learning can be employed to solve these issues. Because if you look at the problems that you highlighted, I believe if the data are actually available, then it can be maneuvered towards finding the better solution. And secondly, from what Mr. Debo said, I'm so sorry, I don't know whether it's Dr. Debo, Mr. Debo. He mentioned that if all these technologies are being employed, how are we going to be able to retrieve the technologies back after being used? Then I think we should try to look at the issue of reverse supply chain. A reverse supply chain in the sense that it is not going to be a one-directional use method of use. That after this particular technology is, for example, now let's just say you have a distribution hub in Lagos and Abuja, and secondly, from Abuja, you also have a distribution hub in Kano. Then let's just say you are trying to start, you are going to start your distribution from Lagos using that same technology that you said you want to use. Then that technology is not going to be like, it's not going to be unidirectional in the sense that it won't only serve Lagos and Abuja. It can also stem from that Abuja to Lagos. And secondly, maybe there is another transportation that is coming back from Kano to Abuja. It can also be employed. In that way, you are going to maintain a cycle of network for that particular technology, so that it can be able to be more efficient and effective in terms of use. And it's also going to be cost effective because you are not going to be using it for only one purpose. For example, now it's serving both Abuja, from Lagos to Abuja, from Abuja to Kano. Then definitely there is a way we could be able to arrange a system in which maybe you are going to be supplying from Kano back to Abuja, then from Abuja down to Lagos. So it's going to be a cycle, then so that the technology is not going to be a waste. I really don't know whether you are trying to get my point, sir. Thank you very much.
I can.
Thanks, Shane. Yeah, quickly. So it's almost, I mean, one of the that came to mind there, I know, is that while speed is of the essence for the vaccine getting to the point of sort of patient care, then there's not necessarily the requirement for that courier speed and therefore courier cost for the technology to come back. So maybe there's other sort of supply chains that can bring that technology back. And so long as it's still within a reasonable time frame, then maybe that's one of the ways that we could sort of lower that that sort of cost to serve, if you like. But
yeah, so I actually want to answer that too, because I think he's brought up two things. He's brought up this notion of a reverse supply chain as well as AI and machine learning. All of those types of strategies require a database. They require proper input of information and analysis of information. Specifically, AI and ML require vast amount of data points to start to become effective, right? And so that is what Medsaf has been working on since 2017. Building a database that can track and trace, understand movements, fluctuations, etc. So I think that for this to be something that works from a countrywide or even potentially even just Africa-wide, there needs to be, first of all, the government needs to start, supporting and financing, with grants, etc., these types of solutions so that they can scale faster, right? But also there needs to be, incentives for people to start to, set up their businesses that way, or actually revamp their businesses to actually have, standardization in how they collect information, so that you can start to build technologies on top of this database that can connect, can understand where things are across the country, that can talk to each other. But it's going to take some leadership. It's either going to take Medsaf to become, the biggest pharmaceutical tech company in Africa very soon, which we will be. But before we get there, it's going to take collaboration from, it's going to take incentives and leadership from the government, as well as all of these other institutions, to kind of decide that we're going to go one way, so that we can start talking to each other, so that our technology can start talking to each other. And then you can start implementing, reverse, if I use cold chain, but then maybe even a food vendor uses cold chain too, or, another type of company, we can all kind of plug in, that's a whole business. Whoever's listening and you want to start a business, that's a great idea. Be able to create a network where, various different types of companies can plug in, to a database and know where cold storage options are, close to them, you know, as we ship back and forth, you know. So these are the types of things that need to start happening, but it's going to take a database and transparency, and it takes doing something the same way, which if everyone's doing their own thing, doesn't happen.
Thank you very much. Thank you very much, Vivian, because I think it's really clear, and it's important to express the fact that, you know, one way to go about this is to really invest in the system. If we're going to get a future where these things are going to be cheaper and more affordable, we have to invest in the distribution, like you rightly said. And one way to actually pull in the need to do that investment is to find the avenues for optimization of the investment. So if I create a logistics network, or I create a database, or I start to lay out foundation for what Vivian has done, and this is quite similar to what the work we're doing at Doctoora, where we are going beyond pharmacy units. Obviously, we work with pharmacy partners, but running a network of hospitals also means that I need to decentralize my kitchen and have a food delivery network to service all my hospitals for efficiency reasons. I have to centralize my pharmacy and have one central pharmacy servicing all my centers. I have to centralize my diagnostics and get all sample collections and all the back and forth. And then I have to also centralize my logistics. And in achieving this nationwide, then it makes a lot of sense for me to invest in coaching along the whole pathway, because my restaurant guys are going to use it to transport food. The vaccine guys are going to use it. The medication guys are going to use it to transport medication. At the same time, the diagnostics units would also be using it to transport diagnostics. So it gives that sort of scenario of that was painted by the opinion shared by Mr. Aziz, where obviously I can figure out how to optimize those resources as well as service underserved communities, and hope that, like Vivian said earlier, the government actually creates the enabling environment for us to be able to interact with them as startups and deliver the work, because we are focused on efficiency. The reason why we've gotten into business is because we've seen a lot of inefficiencies that we can solve, and they own a lot of these inefficiencies. Their willingness to hand the inefficiencies to us to resolve is the political will that we really talk about on a day-to-day basis, and the economic impact of how we can deal with that inefficiency and turn it to money for the country. Leverage all the things that RMX has been invested, all the resources that Gricd as a technology company is trying to invest, and the future for machine learning, if we do successfully gather all the data points and get everybody to uniformly standardize data output and input. And I don't think that you couldn't have said it any better. Thank you.
Okay.
100%.
Thank you.
Thanks,
one last question.
Yeah, so also.
Sorry, Taiye.
Okay. I just wanted to have.
Coming for Taiye.
Okay. So it's going to be a quick one. I think there has to be new entrants. There has to be new entrants into the space, because what you have right now is a very nascent industry for the coaching.
Taiye, we struggling
for the coaching sector. And if you guys reverse logistics. Okay, can you hear me now? Sorry.
Yes.
Okay. Okay, so one thing that is interesting is that this case is actually predominant for pallets, right? But you notice that a whole lot of industries use pallets. And in the developing world, in the developed world, they've actually been able to create industries or create companies that actually come together to return pallets back to the point of origination. But for this industry, you don't really have a lot of players, you know, because as the other panelists have said, the government actually has to create that enabling environment for much more option, because sometimes there might be huge competition between the big players and the small players. Then at the end of the day, the collaborative effort there doesn't yield that output that you intend to, that you need. So I guess it's really, really important for policies, for frameworks like incubation platforms that the government can actually invest in new businesses to enter this industry. And also tax havens, tax holidays, let's provide this to different companies so that they can start, businesses in this field. It's a very, very, very promising field. It's extremely promising because so much opportunities. Thank you.
Thanks, Terry.
Yeah. So
Emily, over to you, please.
Yes, hi, good evening, everyone. My name is Emily Sheldon. I'm the co-founder and CEO of the African Health Innovation Center. We're located in Accra. And as an intermediary organization, we have a lot of opportunities to sit down with large UN agencies, with investors, with large corporate private sector partners. And one of the most frequent questions we get is, what are we getting wrong? What are assumptions that we're making that we should correct? And so my question to you, I know you talked about a lot of challenges that you're facing already, but if you were to sit down with these people and you could say one thing that they think they're doing to help you when really it's wrong, they should be doing something else, what would that be?
I can take that. So I think that a lot of, I'll just give my own personal experience, right? I think that there is a language that, the aid agencies, the NGOs, that they speak. And then there's a different language that startups speak. And I think that there's sometimes, it's hard to connect the two. And so in my own experience, I see, the opportunities of how, Medsaf could be extremely helpful and solve a lot of the problems, that I see some of these NGOs trying to solve, but then but they typically will tend to stick with players that maybe understand their language, right? So I think that, especially in a Nigerian perspective, which is very different from East Africa or Kenya, where a lot of, these aid agencies are historically have been, I think that they're on their end, they need to start to open their eyes and be more, just more open-minded to trying to understand how people are actually really solving problems on the ground. Because I do tend to see a lot of money go to players that don't have the ability to actually execute the way, or even the price or the transparency that they probably are looking for. But there are a lot of, startups that would be able to kind of give that really good service, but get overlooked because maybe they don't know how to write grants well. Maybe they don't have access to a grant writer, or, maybe they don't have the packaging that, so I think that's something I would say. But otherwise, there's hundreds and hundreds of thousands of startups that are trying to solve really extremely hard problems on the ground that aid agencies should have access to supporting. And so there is a disconnect, and I think, maybe there just needs to be a kind of, coming back to the table to see how to actually work with, not just government, not just large corporations, but also some of the other players that actually solve problems too.
Okay. Thanks very much.
If I might add, I think a critical kind of addition to what Vivian has said is that a lot of the interventions are typically push interventions. So you're just telling people what you think would be good for them, and you're paying for that on their behalf. And that is, I think that is a very critical issue around the solutions that we've seen that have failed in Africa and those that actually have been adopted. From my experience on the field, I go into a community, I speak to the members of the community, and I understand exactly what they need. And that requires a certain amount of access. It also requires a certain amount of distributive effort on my end to be able to go gather the information and then use that information to fine-tune solutions, because it needs to be pulled. Give an example. One of the few communities that we visited in the last few weeks, I had an ex-military man who is now the lead community engagement person for health, as well as the political and community leader there. Now, he says he has been working time without number, trying to get resources to ensure that their maternity services in that area can be revived. A picture of the services and the state of the things there was quite an eyesore, because they essentially do not have a facility. And this is somewhere where the women have to travel long distances over water, and most cases they have to deliver on the water before they get to the nearest maternity. The issue is that there's a big disconnect. That man knows exactly what they need. He knows that if they can do well with the nurse, with some renovations and some stuff. But the political person or the politician thereabouts who is representing that area, who has access to all the donors, who has access to all the people who could potentially want to channel funds into, doesn't even know what they need. And even when he knows what he promises, and that disconnects the impact of not getting the solutions to people is the major thing, because we don't know how it hits. We don't know what part of the shoe hurts or how they're actually experiencing life without these critical resources that we're trying, or these critical solutions that we're trying to get to them. So I think it's important to always really get the stuff to the startups, like Vivian said, but also get to the people themselves to ask what you need. And again, avoid the duplication of functions, and go with people who have actually gone into the field and can show you real data that can be verified, and to be able to implement and drive change. Okay.
Thanks, Debo. Thanks, Debo. Taiye, I think we're over time as it is. Should we move over to Simi?
Yes. So thanks a lot to our panelists. Up next, quickly, Simi will just go over her the one-page slide, and then we try to wrap up from there. So Simi.
Okay, thank you. Just to confirm, can everyone hear me?
Yes.
Okay, thank you.
Yes.
So my name is, yes, thank you. If you can see my screen as well. So good evening, everyone. My name is Simi, and I'll be introducing one of Gricd's products, which is the Gricd Moat. The Moat, as we can see on the slide, is a real-time data logger that provides you with the temperature, humidity, and location of your pharmaceutical or agricultural commodities during their storage or their transit. So this information is displayed in real time. That is the temperature, humidity, and location is displayed in real time as it is being read on a web application and a mobile application, which can be accessed using a mobile phone or a personal computer. The software is designed with the intention of improving the experience and the ease of use of mainstream monitoring software for our users. As we can see from the features by the side, as we can see from the features by the side, the Moat allows you to monitor the temperature, monitor the humidity and location of your sensitive goods, and they deliver immediate alarms and notifications when an anomaly in the temperature or humidity is detected. One of the people who was asking a question said, you have to get to your location before you can see the real-time info or before you can see data from the data logger. So the modes are designed to send immediately any anomaly is detected. They're designed to send immediate and real-time alarms and notifications to our users anytime an anomaly is detected. And they also have a battery that lasts up to 30 days on a single charge, which caters for long distances and long trips. The mode devices are easy to integrate into existing cold chain infrastructure, and they give you more visibility into the cold chain management and help you improve its operations. They also reduce the amount of loss of wasted perishable commodities, improve the customer trust that you're providing them with quality products, and further boost your reputation. And finally, they provide the data and reports that is required for you to support or prove settlement claims, such as legal claims. So this is the modes. Thank you.
Okay, thank you very much, Simi. I think you can. So if you have any questions as regards to the modes or the technology, time's fast spent. So any questions? No questions. Okay, awesome. So we're at the end of today's event. I would like to thank everyone for being part of this first edition. Thanks to Gavin and the rest of the well-seasoned team that spoke on today's panel. It was really, really interesting and really, really engaging for even myself that's in this space. I did take a lot of notes and I did learn, and I got a lot of opportunities, especially when it comes to reverse logistics and also a database of possible cold rooms and things like that. I think it's also really, really interesting and ties into our business offerings. So once again, thank you very much for being here. And hopefully we would have you on our next session. Thank you to everyone who's joined us. Thank you to the panelists. Enjoy the rest of your day. Bye.
Thank you. Bye-bye.
Thank you, Taiye.